story as well. In the meanwhile, here's a report on why there is a need for this kind of guidelines from AIIMS. We're seeing a number of cases of black fungus being reported across the country. So it's not just about coronavirus that doctors have to worry about now. It's also cases of black fungus.
Monster COVID surge. Coupled with rise in cases, black fungus have added to the nation's woes. From Uttar Pradesh to Karnataka, black fungus infection cases have been reported in various parts of the country.
म्यूकोरमाइकोसिस एक फंगल इन्फेक्शन है। इसके जो स्पोर्स हैं इस फंगस के वो मिट्टी में भी पाए जाते हैं, हवा में भी पाए जाते हैं, कुछ हद तक ये कहते हैं कि फूड में भी पाए जाते हैं।
In Bengaluru, the magnitude of the crisis is such that antifungal drug amphotericin B is hardly available.
We had not really anticipated a surge like this and not really ready with the kind of supplies. The mainstay of treatment is a drug called as amphotericin B. This drug suddenly has been on high demand and it has been going out of shortage. People are facing shortage.
To mitigate the crisis, many hospitals in Bengaluru have set up special care units dedicated for those infected. This decision comes after many COVID patients succumbed to the black fungus infection.
People who are diabetics who get COVID infection, after the 9th or 11th or 15th day, you start getting swelling on one side of the face. And in some people, the eyeball also slowly starts popping out and the vision starts gradually coming down.
With Nabila Jamal, Bureau Report, India Today.
And in a big shift from the previously set standards on COVID-19 treatment, the government has now officially dropped plasma therapy from COVID-19 management guidelines, saying it's been found to be completely ineffective in preventing deaths or, for that matter, controlling the severity of the infection. It's a full 360-degree turn on the use of convalescent plasma therapy in India. But it's not something that one didn't see coming. For months, the ICMR and National Task Force were deliberating on dropping plasma therapy for treatment of COVID patients admitted in hospitals with moderate to severe disease. In a letter to India's principal scientific advisor, experts in public health had warned against the use of plasma therapy without any hard scientific evidence. The concern was that it raises the possibility of more virulent strains of COVID-19 due to its unregulated use. The letter was signed by Professor Gagandeep Kang and surgeon Pramesh CS, among others. All along 2020, plasma therapy worked as one of the saving arsenal in India's fight against COVID-19. But ICMR's own study last September showed that plasma therapy failed to save people who were dying from COVID-19.
कन्वेलेसेंट प्लाज्मा है जो कहते हैं प्लाज्मा या फिर टॉसिजुलिमैब है, these are only under emergency use authorization और इसमें कोई strong इतना डेटा नहीं है.
India had conducted the world's largest randomized controlled trial to study the efficacy of plasma therapy. Trials were done on 464 patients in April and July at 39 centers across India. Results revealed that plasma did not show any significant difference in mortality between those who got it and those who didn't.
उसके जो रिस्क ज़्यादा थे और बेनिफिट्स जो थे वो नेग्लिजिबल थे। तो इट इज़ अ वेरी वेरी वेलकमिंग स्टेप और उम्मीद करता हूँ कि ये जो इन्फॉर्मेशन है अब एंड यूजर्स तक, हर हॉस्पिटल तक, हर डॉक्टर्स तक जल्दी से जल्दी पहुँच सके, ताकि हम जो सफरिंग है प्लाज्मा को ऑर्गेनाइज करने के लिए, जो पैसे जा रहे हैं, रिसोर्सेज, टाइम और जो गलत होप जो बन रही थी, हम उसको आगे बढ़ावा ना दें।
But the indiscriminate use of plasma therapy saw state governments and civil society groups appealing to donate plasma to save lives despite any hard evidence. Several state governments came forward to create plasma banks to store plasma of recovered COVID-19 patients. Many even became plasma donors. An ugly side also emerged: black marketing of plasma for profits, which India Today also exposed.
Even a Lancet study, meanwhile, has discredited the use of plasma therapy as being effective in hospitalized patients having moderate to severe symptoms of COVID-19. The clinical management guidelines in India now only have remdesivir and tocilizumab as off-label use in hospitalized patients. Meanwhile, one is left asking, was plasma therapy a sense of false hope all throughout last year in the fight against COVID-19? And what will happen to the plasma banks that have been set up by many states in hope to save lives during the pandemic? With Sneha Mordani, New Delhi, Milan Sharma for India Today.
So here's why plasma is no longer part of India's treatment protocol against COVID-19. Experts and scientists have said that convalescent plasma is not associated with a reduction in COVID spread in a patient's body. They've also said that there is no difference in COVID-related deaths due to the plasma. It doesn't mean that the patient recovers or that the severity gets lessened, or that it doesn't ensure the patient's death just because they've been given plasma. It also raises the possibility of developing more virulent strains due to irrational use, and this is hugely problematic. This is why scientists have recommended that plasma be removed from the treatment protocol, which the government has now agreed to. Milind Sharma is getting us more on this. Milind, there's been a lot of debate and discussion on plasma, particularly in the second COVID wave, and there are also questions being asked of whether this could have been done earlier, whether the government should have removed plasma from treatment protocol. It would have saved a lot of families a lot of time.
Well, Akshita, that's a very important question. But what we saw in the first wave of COVID-19 was more dependence on plasma therapy and injections like remdesivir. But in the second wave of COVID-19, there was lesser dependence seen on the donation of plasma, as oxygen was required more for the patients who were being admitted into hospitals with moderate and severe symptoms. So their only saving grace was oxygen that was being used as a drug. This time around, plasma therapy donations were not even as much as they were seen in the previous wave of COVID-19. And also the fact that plasma donation had now become a scourge because people had to find someone to donate plasma. Many were not willing to donate plasma after being recovered from COVID-19. And there was a lot of back and forth with scientific data also stating that it could possibly lead to virulent strains of the virus coming forward because of the antibodies that are put from one person's plasma into another person who's suffering from COVID-19. Right. And there isn't enough data to prove that it was indeed helping people, saving them from death due to COVID-19, which is why the government, to stop unregulated use, has now removed it from the clinical protocols of treatment in India.
All right, Milind, thank you very much for joining us with all those details. So no longer will plasma be used in India to treat COVID-19. Sticking to stories on the coronavirus crisis, what we've been seeing in the last 1 year is some very bizarre and loose statements from some politicians who are giving and doling out their own advice on how to fight COVID. The latest in that list is Bhopal BJP MP Sadhvi Pragya, who finds herself again in the midst of a controversy because she's claimed that she's not been infected by COVID-19 as she regularly consumes cow urine. If that wasn't enough, she even proclaimed to others that drinking cow urine can cure lung infection. Now, Pragya Thakur's bizarre remarks come at a time when the country has been reeling under the COVID second wave. Remember that earlier she had proclaimed that chanting Hanuman Chalisa can cure COVID-19. She unfortunately isn't the only politician who made such bizarre claims. Last year, Union Minister Arjun Ram Meghwal had claimed that Bhabiji Papad can cure COVID. BJP MLA Shuman Haripriya last year claimed that cow dung can rid you of the virus.
देशी गाय का पालन करिए। देशी गाय का गौमूत्र अगर हम लेते हैं तो उससे हमारे स्वाइनफ्लू का जो इन्फेक्शन है वो दूर होता है। मैं बहुत तकलीफ में हूँ, लेकिन मैं प्रतिदिन गौमूत्र लेती हूँ और इसलिए मुझे अभी कोरोना के लिए कोई औषधि नहीं लेनी पड़ रही है। ना ही मैं कोरोना ग्रस्त हूँ और ना ही ईश्वर मुझे करेगा, क्योंकि मैं उस चीज का, उस औषधि का उपयोग कर रही हूँ।
Now, in the time of a pandemic, the last thing you need is these kind of statements. And unfortunately, we've had a whole barrage of them. The latest in that list is Pragya Thakur, who has said that drinking cow urine can cure lung infection and help in fighting COVID. She says that's why I'll never get coronavirus. But she's not the only one who's made these kind of comments. You had a union minister, Arjun Ram Meghwal, who last year had said that Bhabiji Papad can cure you of COVID-19. And then you had another statement. This was in July 23rd last year, where you had Rameshwar Sharma, who is the pro tem speaker in Madhya Pradesh, saying that the construction of the Ram Mandir, of the Ram Temple in Ayodhya, will actually end the spread of COVID-19 in India. Soon after, you had also Sambhal Shafiqur Rahman, who is an SP MP. He made a comment saying opening religious places will slow down the spread of coronavirus. Several other such loose, bizarre statements. Ashwini Chaubey, another union minister, making this irresponsible statement, saying sitting out in the sun for 15 minutes can kill the virus, can kill COVID-19. In March last year, when COVID-19 was spreading during the first wave, you had also Shuman Haripriya, who's a BJP MLA, saying that cow dung and cow urine can rid you of coronavirus. Needless to say, only listen to your medical practitioners on what works and what doesn't in the treatment of coronavirus. And unfortunate that our politicians who are supposed to lead by example are making these kind of statements. Let's move on now to another story that we're tracking here on India Today. The DRDO has rolled out its anti-COVID drug 2DG, developed in collaboration with Dr. Reddy's laboratories. Now, 2DG essentially can reduce oxygen dependence in moderate to severe COVID-19 cases. Essentially, this is for hospitalized patients. And a lot of questions about whether this is the wonder drug that India has been waiting for.
India has added another arsenal in its fight against coronavirus. The first batch of the 2DG, or the drug known as 2-deoxy-D-glucose, the drug known to reduce oxygen dependency in hospitalized COVID-19 cases, was unveiled.
आज के दिन जो ये नई दवा 2DG के नाम से देश के लिए उपलब्ध कराई जा रही है, डॉक्टर रेड्डीज लैब ऑलरेडी वैक्सीन के फ्रंट पर भी महत्वपूर्ण भूमिका निभा रहा है और कोविड के खिलाफ हमारी लड़ाई में, उस जंग में हमको और मजबूती प्रदान करेगी।
कोविड में विशेष रूप से यह ड्रग बहुत ही अपनी प्रभावी भूमिका का निर्वाह करेगी। यह आशा और उम्मीद की एक नई किरण लेकर आया है। हम कोविड पर विजय प्राप्त करेंगे, इस संकल्प के साथ हम सबको आगे बढ़ते रहने की आवश्यकता है।
The drug, developed by the Defense Research and Development Organization in collaboration with Center for Cellular and Molecular Biology, Hyderabad, and Dr. Reddy's for treatment of COVID-19, was approved by the Drugs Controller General of India on May 8th for emergency use in moderate to severe cases of COVID-19. Clinical trials results show that the drug helps in faster recovery by settling in the virus-infected cells and preventing virus growth by stopping its synthesis and energy production. The drug is prescribed to be taken orally, dissolved in water. Hospitals will begin to receive supplies of the drug. To start with, nearly 10,000 doses will be supplied to various hospitals in Delhi.
DCGI ने अप्रूवल दे दिया है इमरजेंसी यूज एडजवेंट थेरेपी। सो ये अभी पिछले 10-15 दिन से जो हमारे पास था वो कहीं हॉस्पिटल्स में डॉक्टर का प्रिस्क्रिप्शन के ऊपर भी दे रहे थे। अच्छा सा रिकवरी है पेशेंट्स में, जल्दी से रिकवर हो रहा था, ऑक्सीजन का डिपेंडेंसी बहुत कम था।
Drug manufacturers claim that the drug will be effective against all variants of the SARS-CoV-2 virus currently circulating in India. The second wave saw higher dependency in moderate to severe cases of COVID-19 effectively. The use of 2DG drug could begin to provide some relief and reduce stay in hospital for COVID patients. Bureau Report, India Today.